ligaments and the support of the ovaries and the uterus. The ovaries are kind of suspended between two. So coming down from the posterior abdominal wall, it branches off of the aorta. We have the ovarian artery and vein. And the gonads are not in a scrotal sac, they're in the pelvic cavity, so they don't go through the deep inguinal ring. And following those and attaching to the superior aspect of the ovary is a ligament appropriately known as the suspensory ligament. And then between the uterus, let me move that over a little bit more. Between the uterus and the ovary is the ovarian ligament. The full name is the ovarian ligament proper, but typically now it's just referred to as the ovarian ligament. Does any of this remind you of a male structure that we talked about? Exactly, the gubernaculum testis. Remember I said in the male development the upper gubernaculum disappeared? That's what in the female becomes the suspensory ligament of the ovary. So over here, the upper gubernaculum, and I'm going to put it in parentheses since it actually disappears, is homologous or equivalent to the suspensory ligament. And the lower gubernaculum, what we know is the gubernaculum testis, is the ovarian ligament. It also continues from the uterus, which is, it's not shown here, but from the uterus forward, if I can find an image, right here. So here's the ovarian ligament. From the uterus forward to the deep inguinal ring, it keeps the uterus tilted forward. This is known as the round ligament. So the gubernaculum testes forms the ovarian ligament and the round ligament.
Oh.
Remember in the male, the gubernaculum testis is pulling the scrotum through the inguinal canal, and as it shortens, it itself is attached to the scrotal wall from the inside. So in the female, what's our homologous structure to the scrotum? The labia majora. So the round ligament passes through the deep inguinal ring, which would be right here, through the inguinal canal and into the labia majora. So we see that equivalent structure in those components. We'll look at the round ligament when we get to the uterus. And when we get to the uterus also, we'll talk about this mesoovarian, which is a very thin membranous support. We have this image of the ovary. So here's the ovarian ligament. The uterus would be over here. And with the ovarian artery and vein, we have the suspensory ligament, which isn't really illustrated there well. And this is similar to the adrenal gland. The blood vessels come into the center of the gland. And so we have the medulla, which is where the major branches become smaller and move out. The cortex is where we have all the oocytes. So tomorrow when we talk about oogenesis, or actually we're going to talk about oogenesis tomorrow, but next week when we talk about the uterine cycle and the ovarian cycle and so on, the hormonal cycle, we'll come back and talk about these structures. Right? So I'm not going to cover those sequences right now. But these are where we find all the oocytes. Oocytes are released at ovulation through the surface, and so there's a disruption on the surface of the ovaries for every oocyte that was released. Yeah.
What grabs onto them? The follicles?
So the follicles are all of these cells around them.
Okay.
So what grabs onto them, nice segue, thank you, is the uterine tube, the fimbriae. So these finger-like structures actually remind me of anemone because they swing and move around. Is actually muscular contraction for that. Okay, may I erase this homologous list here because I want to draw the uterine tube out.
Yes.
Actually, I'm going to redraw this. Now, in actual position, a lot of our images of the uterus and ovaries are kind of shown in this fashion, where it looks like it's a T. Okay, I'm going to be the uterus a couple of times today. So find the uterus, and my upper extremities are the oviducts. Many of the images show it like this. In actuality, it's like this. So the uterus is bent over the bladder, and the oviducts and ovaries are posterior and lateral. Okay? So if I am the uterus again, bladder's here, I'm bent over it, close to the cervix at right angles. Oviducts go back like this, and the ovaries are back there as well. So it's not a straight horizontal component. It's easier to draw it that way, but I just wanted you to recognize an actual position. So, these finger-like structures, again, are the fimbriae. And they will come close to the ovary at ovulation. They taper, but this trumpet portion is known as the infundibulum, and then they narrow to form the ampulla. To me, this has always been backwards. Maybe 200 years ago, somebody made a mistake, and we just keep perpetuating it. Remember, the stalk of the pituitary gland was called the infundibulum, and the dilated portion of the vas deferens was the ampulla? Well, in this case, we reverse it. The long, narrow portion is the ampulla, and the dilated portion is the infundibulum. The trumpet-like bell part here is infundibulum and ampulla. And then as it passes through the wall of the uterus, this is known as the isthmus. The uterus is a pear-shaped organ. We'll come back to that structure, but I want to finish up here with the oviduct. And it's a little longer component than that. But in any case, the oviduct we saw a little bit on Tuesday, because I was showing you a comparison of its histology to the seminal vesicle. And the oviduct cells, epithelial cells, are simple columnar. With cilia. So the cilia is going to sweep the egg towards the uterus. We look at that fold of the oviduct. Remember, we have these complicated but always free to the surface. Look like this. And so the surface would be a simple columnar with long cilia rather. And so the egg and its surrounding follicular cells is going to be swept along by the cilia towards the uterus, whereas the sperm are deep down in here, much smaller relatively, but you wouldn't be able to see it otherwise. And they're moving from the uterus towards the ovary by the smooth muscle contraction, similar to how they were moved out of the urethra. So the egg's being swept this way and the sperm's swimming and being propelled in the opposite direction. And that also known as, that we have so often, there are multiple names for the oviduct, and I've used a couple. So we have oviduct, uterine tube, older name is fallopian tube. I used to read stories of when my mother was in nursing training, how new student nurses or new graduate nurses in the OR would be sent by the doctors to go find a fallopian tube for them. And they go scrounging through all the equipment looking for this fallopian tube. And like, must not have been very good nursing students, so they didn't remember what the fallopian tube was. And then the Latin term is salpinx. We think of a sphinx, for sounds like it. The reason I put that up there is for one of the membranes is called a mesosalpinx, all right? And a tubal ligation, the equivalent of a vasectomy. Cutting the oviduct is a salpingectomy. So that's where that term comes from. So we look at the structure of the uterus now. So here's the placement. Again, it's not showing it as posterolateral as it really is, but in that relationship. We have the components of the uterus. Let me diagram them now. So this portion up here is known as the fundus, kind of across the top there. Most of the uterine cavity belongs to the body of the uterus. And then this narrowed portion is identified as the cervix. The narrow space the cervical canal, which is also lined by simple columnar epithelium. This opening from the uterine cavity to the cervical canal, the word for opening is os. We have the internal os. That's where the baby's head, if it's being born, is going to pass through to get into the cervical canal. And the sperm coming up are going to pass through the external os first. They're going in opposite directions from the baby. So if a woman has a pap smear, then it's a scraping of the cervical canal epithelia, looking for any changes. There's usually stages. leading from just some changes to actual detection of cervical cancer. This is where the HPV virus, human papilloma virus, HPV organism is thought to affect cervical cancer. And after I took my son in, we switched him from his pediatrician to our family doctor, because he's playing football and basketball and stuff, and our family physician is also a sports physician. And they wanted to know if he'd had his HPV vaccination yet. So they're giving that to boys as well as to the girls. So I suppose so that they don't carry a virus for the cervical cancer. Yes?
Do you know the reason why it's not supposed to be given to girls over age 27 or 28?
I don't know why. It may be that they haven't tested them for it. 2 or 3 years ago, I came down with shingles, which is you had chickenpox. The shingles the virus hides in the nervous system, and then under stress comes out and reproduces again in the skin. It was the beginning of Christmas, like Christmas Eve. I got it. I don't know what my stress was.
It was painful, wasn't it?
Yeah. I thought maybe I'd come down with breast cancer or something, because it was right along this area here. And I looked it up, the breast cancer is asymptomatic. So I'm like, okay. And of course, over the holidays, it made it too late to get the antiviral injections. But on that one, there's a shingles vaccination. You may have seen them advertised on TV. And it said it was only for people who were over 60. And I was like, well, why? And it had only been tested in that particular population. So they didn't know the side effects for it in younger populations. So I don't know if that's the reason they say it's only available if you're less than that age, if it's just that they tested it on a younger population. That's all I can come up with. It's not that there's anything peculiar about it that would not. I think it would be just as effective in somebody that's older. All right, so in looking at the blood supply here we're going to be doing the layers and the endometrium, all of that next week. But obviously the ovary is going to get its own blood supply via the ovarian artery and vein. So that's going to be coming down here. We find it with suspensory ligament. And then blood supply to the uterus is a branch of the internal iliac. Now, we haven't done the blood supply yet, but that's branches that are found in the pelvis itself. And so these go up and can also send branches to the ovary as well. And we'll look at that distribution next week when we talk about the endometrium. And then below that, we have a smaller branch that's the vaginal artery. So now let's look at the ligaments, and that's where we'll stop. Is look at the ligaments that support the uterus.